مشاهدينا الكرام في كل مكان، السلام عليكم ورحمة الله وبركاته. أرحب بالجميع في حلقة خاصة للتوعية بأمراض الجهاز المناعي وبأهمية جهاز المناعة في جسم الإنسان. سعيدة في الحلقة دي يكون معي الدكتور ينوش كادار من المجر. Welcome sir.
Hello.
Hello sir. So you are immunologist. First let's try to give a definition for immune system.
Yes, I came from Hungary and work at a big hospital in Hungary, and my first profession is dealing with autoimmune diseases. Mm-hmm. That means there are people with different inflammatory problems that come and I visit them.
Mm-hmm. What's the immune system in the body?
Well, it is a defending system that helps you to make change between own and foreigner. Mm-hmm. And illness comes when this distinction is failed.
Okay, and what does the immunologist do in this case if this immune system have problems?
Almost all the illnesses can be led to this problem, but there are some cases when this is the biggest problem. The main problem is that the recognition of the immune system is wrong. I mean, it can recognize own as foreigner. Mm-hmm. And makes a big armory against own. And this leads to inflammation and different signs of illnesses.
But there is autoimmune disease, and this disease is very dangerous. So let's just try to highlight what autoimmune disease.
Autoimmune disease is when your immune system fails to recognize your own, makes an inflammation, mm-hmm. and several organs are affected. In some cases, systemic form. You are fatigued, have a weight loss, pain in joints, fever, bad feeling, and without treatment it is a persistent thing. And there are organ-specific autoimmune diseases when not the whole body system is sick, but rather your thyroid or joint or skin or bowel or liver. So just one type of organs are sick.
Mm-hmm. An autoimmune disease caused by what?
Well, nobody knows what
Until
is
now.
the reason. There are several factors that provoke the false recognition or the flare. I mean, sun, UV ray, diet problems, even a viral infection. But there is a definite genetic and inherited background also.
Is it cured or uncurable disease?
It depends. What do you mean by that cured? If you take a painkiller against a pain, it's cured somehow.
Okay.
If you take some anti-inflammatory drugs, and you will not feel pain, and it's cured. So if you take care of the basic immunological mechanism, it's somehow suppressed. Vital organs will be spared. You will have a better life expectancy and life and feeling and less symptoms. But as we know only these symptoms and we don't know the reasons, right now it cannot be cured etiologically.
So I can cure my symptoms, but the disease cannot be cured until now.
Well, the disease can be cured by means of immunosuppression, anti-inflammatory treatment, but cannot be cured as the etiology, as the primary reason, we don't know.
Okay. When try to think about autoimmune disease, under what case or which complaints from the patients?
First of all, it's not a sudden thing. So it is smoldering, goes step by step, slowly develops pain, fever, low-grade fever, weight loss, fatigue, joint pains, skin signs. So not a very short course symptoms with lots of different, not very specific signs of inflammation.
Many diseases have same symptoms.
Yes.
But when we talk about autoimmune disease, it's need really to notice very right and very quickly what kind of this disease.
Well, almost all the autoimmune diseases are slowly developing. So they don't seem to attack fast. Well, if I see at you, I can decide that you don't have an illness like that is having a time factor. That is very needs a sudden intervention. So all the autoimmune, or most of the autoimmune diseases are slowly developing, not needed sudden intervention, just inflammation of the whole body.
Is it for you as a doctor mean anything if the patient needs regularly, as regular times to go to the center care?
Well, regular visit is good, but doesn't defend against illnesses.
Okay.
So, first of all, well, if someone has a screen and there some bad results are seen, one can say he's prone to autoimmune disease, he is a candidate for autoimmune diseases. Then I ask the patient to show up again several times in order to screen, in order to find out in time or as early as possible, because this illness flowers, and if the whole illness is seen, it's not a big deal to find out that such and such an illness.
Okay.
The clue is to find it at the beginning.
Okay, doctor, one of the most common questions, especially from the female patients, the woman can be pregnant if she have autoimmune disease, and it's correctly everybody notice it around of her.
The most common symptoms, if you ask it, like early morning stiffness of small joints, in hand, almost symmetrically. This stiffness lasts not some minutes, but at least half an hour or an hour. The same in legs, low-grade fever, bad feeling, weight loss, sensitivity to sun, special rash to sunrise, sometimes hair loss.
Can she be pregnant or safe for her and for her baby?
Well, an autoimmune patient should take much care of pregnancy and having a baby. So the better period, the better time is when the illness, if it is founded, if it is not active. So she must find with her doctor the best time to get pregnant in order to have the less risk that during the pregnancy the autoimmune disease wouldn't flare and the baby would be healthy.
And if she is already sick and she's taking a medication for one of the autoimmune disease, can she be pregnant?
Definitely. There are some.
Yes or no?
Definitely yes.
Okay.
There are some medicine that cannot be or must not be taken. So the immunologist must help to choose those that are not dangerous for the baby. The other is to find out what is the optimal time for pregnancy, and the doctor must help or is required to help what is the optimal dose of for these medicine are, because pregnancy might first of all aggravate the autoimmune disease.
Yes.
Pregnancy can be terminated by itself with an abortus
Yes.
due to the autoimmune disease, or the embryo or the small newborn can be hurt also if
Yes.
mistreated.
Okay. What about sunbathing? I feel like it's so common as lifestyle for many people.
It's very hard to say not to go to sun, especially in
Yes.
Sudan. Yes, as we don't know the reason for autoimmune diseases, and we know just provoking factors, and one of these factors is the UV light, UV beam, and sunshine. The general recommendation is to find shelter or use sunscreen,
Sunblock, like cream.
yes, creams, because it's not the sun not only destroys blood, not only destroys skin, sorry, but can provoke a systemic flare of autoimmune disease.
People think sunbathing is very helpful and very healthy. Okay. Anyway, lifestyle, like it's fine or it's okay if I force the pain joint.
Lifestyle is okay.
Work, sports.
Well, everything is okay. You know, if someone has an inflammatory joint disease, the index that helps you not to move more is pain. So as long as your joints are good working, not paining, not aching, then you can move on. It doesn't hurt.
Okay, doctor, we will come back after the break to follow our questions. بعد الفاصل مشاهدينا راجعين نواصل.
لأننا نعرف قيمة الوقت. وماذا تعني لكم الراحة؟ نفعل المستحيل لنجعل رحلتنا أكبر متعة، أفضل رفاهية، وأكثر فخامة. لأننا نختلف عن الكثيرين، يختارنا آلاف المسافرين. ولأننا طيران المستقبل، نقدم الأفضل. بدر للطيران، بدر يتلألأ في السماء.
مرحبا بكم مرة ثانية مشاهدينا الكرام. بنتواصل مع الدكتور ينوش داخل الاستوديو. Welcome again, doctor. I want to ask you about autoimmune disease. Is it pass?
Autoimmune disease, is it?
Pass, or we first talking about there is no cure until now for this? Yes.
Yes. Well, it's a philosophical question because
Yes.
You can give immunosuppressants and the patient has a good life expectancy and good lifestyle. Besides, not all of the autoimmune diseases are permanently persisting, so there are sorts of sicknesses like this. For example, lupus, it waxes and wanes. There can come a 10 years period when there is nothing. So from this point of view, it can be cured. There are some which is smolderingly ongoing. The end is that some connective tissue organs can be destroyed.
There is levels or degrees for this disease, or the disease can be developed by the time.
The disease is, develop from one to another, and that can start with a connective tissue disease and can go into a joint disease like rheumatoid arthritis. So these are not strictly divided into separate entities. The other is that after a while, as age going on, it generally diminishes, the activity decreases. So it's very rare that really elder people get autoimmune diseases as a very new one.
Okay, what does that mean if we said autoimmune disease is active or not active?
Okay. Well, if you have a problem, it can be a problem from the past, and it can be a new problem. So you must make a distinction between damage and activity. Damage, if you have a bad skin destroyed by the previous inflammation, you don't have tears enough, and your eyes aching and itching because of lack of tears. It is not necessary because of the actually ongoing inflammation. It can be a remnant, a result, a ruin of the previous inflammation that destroyed salivary glands, skin, connective tissue of the face, and so on.
So if I had this disease before in my life and it came back again for me, it will be noticed, right?
Yes. Yes, but you cannot cure the damage. So if something is gone, the doctor cannot make new organ. So if some liver is destroyed by cirrhosis due to an autoimmune inflammation, skin is destroyed by lupus of the face, you are not expected to give medicine because this is belonging to the past. The only possibility for a doctor is to prevent the deterioration, the new inflammation.
Okay. Is there anything the patient can do to reduce the chances of getting this disease in the past, in the future, or now? I know your philosophy about this because you said we don't know where the disease came from until now, so we can't avoid it, right?
Yes. So as it is, as these diseases, because it's not a one disease, it is a group of diseases. Okay. So as these diseases are of unknown origin, we just know provoking factors like sunshine, like diet, like the microbiological flora of the bowels, like drug intake, like alcohol consumption.
Like smoking, maybe? Smoking?
Yes, definitely. So we just know epidemiological data, what means we just know coincidences. The one who goes to sun with this disease has a bigger chance to have a relapse. So just observations and statistical calculations, it is called epidemiology, how external factors regulate the outcome of the disease.
Okay. If we go back or went back again to the symptoms, fever, one of the symptoms. Okay. In case of permanent fever, when we should think about serious illnesses, not just like autoimmune disease.
So fever is just a symptom, a sign that the patient complains. And most of the illnesses behind are self-limiting diseases. So what we generally see that a permanent fever, continue high fever, can diminish, can disappear after some days. So there are medical recommendations when you should take fever into account seriously. It is called fever of unknown origin. And if a patient with such and such a days and such an extensive diagnostic effort wasn't found what is ongoing right now or right then there is a terminus fever of unknown origin, and that is the point that the doctor's attitude changes to the fever and tries to look at a determined algorithm, the reasons.
Okay. Autoimmune disease can be a background for repetitive thrombosis or repetitive abortions. If the woman have repetitive abortions or problems with thrombosis, it can be a background for autoimmune disease.
Okay. there are lots of reasons for abortions. And not necessarily immunologist is needed for a successful delivery. But there are some conditions when autoimmune system is immune system is responsible for the good delivery and good pregnancy. The two main things. One of the habitual abortion when several antibodies appear, or there is a problem with coagulation system due to immunological alteration, and the placenta's microcirculation will change due to microthrombi in the blood, which is caused by immune system. This is one group. The other group is when there is a problem even to get pregnant. That is a sort of autoimmune immunity. It means that you or the patient his immune system is too aggressive to the circle, to the environment, to the very partner, to the antigens from the outer circumstance. So this is another problem.
Immune system is a partner or controller in the body? Control the other systems?
Well, the immune system's task is to make a distinction between own and foreigners. So it's a partner from this point
Not
of view.
controller. Yeah. Partner makes sense for me. This.
Yes, but you know, if there is a problem, it falsely interprets, and antibodies appear, several immunological problems appear, even well, a partner, because new cells appear from time to time, and the immune system prevents these cells to grow into malignant cells, and the immune surveillance objects most of the tumor cells to home the body.
So sometimes it needs to be controller of the body.
Yes.
To protect the body.
Yes.
Okay. What kind of specialty deal with immunology?
You know, because immunology is an interdisciplinary science, it means, by my interpretation, that takes the whole common pathomechanism in inflammation, cell destruction. So almost all the body is affected. So ophthalmologist with inflammatory eye disease, endocrinologist for thyroid disease, and gastroenterologist with bowel diseases, dermatologist. So almost all specialties meet conditions with immunological significance.
So it makes sense if I think that thyroid disease needs to be noticed or checked or diagnosed by an immunologist.
Yes, there are some thyroid diseases that has immunological or autoimmune origin, like special thyroiditis, like a special overproduction, and like special destruction of thyroids. So all these three are somehow connected in the immune system.
Okay, about thyroid, most people think thyroid is just controlling the level of iod in your body, in your system. Is that right?
Yes, why not?
Simply just like that.
Yes, okay. The thyroids are belonging to the endocrine system, and the thyroid hormone controls the, well, the shortest I can put it that way, the speed of your life, the speed of your circulation, heart rate, digestion, your steadiness to the information from your environment. So it is controls the speed of life, I would say, like that.
I feel like symptoms which coming from the thyroid problem, that hormone, it just seems look like the symptoms for the autoimmune disease a little bit, like losing weight or getting more weight or changing eyes or skin rashing or something.
Yes,
yeah,
you know,
so it's
the
a little bit
general
confusing for me.
Okay, the general symptoms are almost all the same in all the diseases.
Okay.
So thyroid dysfunction can mimic dysfunction of the immune system, but can mimic dysfunction of the digestive system also. Thyroid dysfunction comes with, if it is overproductive, comes with behavior change and mostly palpitation, awakeness, weight loss. Immune problems have some general common with this.
Okay, doctor, I heard in many big dangerous operations, they need to inhibiting the immune system. So maybe they need to put a foreign body into the body, but is it dangerous to inhibiting the immune system sometimes?
Yes and not.
And why?
Because, yes, you know, if the main problem is that the immune system has some misinterpretation and this is leading to an illness by itself, one should rather suppress several functions in order to defend organs that this way can be spared and life expectancy is better. Otherwise, suppressing immunity leads to more prone situation infections, lymphomas.
بسم الله الرحمن الرحيم والصلاة والسلام على سيدي رسول الله الأمين. السلام عليكم ورحمة الله تعالى وبركاته. أهلا ومرحبا بكم مشاهدينا في لقاء خاص، واليوم نتحدث حول قضية خاصة جدا. قضية البيئة هي قضية شائكة وكبيرة جدا وتهم المواطن وتشغل الدولة بصورة كبيرة، وهي مرتبطة بالخدمة التي تقدم بصورة يومية للمواطن، ونحن في حوجة ماسة لتخطيط عالي المستوى وتنفيذ جيد على أرض الواقع. ولذلك اليوم نستضيف سعادة السيد رئيس المجلس الأعلى للبيئة والترقية الحضرية والريفية بولاية الخرطوم، سعادة اللواء عمر أحمد إبراهيم نمر. أهلا ومرحبا بك سعادة اللواء.
ورحمة الله. It's also a very common thing that very young people go through a primary infection and they get a defense against TB and never relapses. And I assume that also in Sudan, the first invasion of tuberculosis is common, and there is a post-infectional defense of people. This can immunosuppressive treatment can lead to a relapse, exacerbation of a disease that once has settled. So if you give immunosuppression on a permanent basis, one runs the risk that tuberculosis will be exacerbated and as immunosuppressive treatment inhibits the proper work of the body, tuberculosis might prograde to a life-threatening condition.
Okay, doctor, if person have a kidney disease, so what it related to immune system?
Okay, kidneys are easily affected in autoimmune diseases, and it is a problem also because kidneys are very important organs, and if your kidney is affected, a special nephritis will develop. This nephritis can destroy kidney definitely, so it can be done back. It's not a reversible thing. Kidney filtering function can destroyed kidneys, protein-losing function can be destroyed. So one has to be very careful in autoimmune diseases with the kidney function, and it has been monitored on a regular basis by a regular algorithm in order to catch the moment when kidneys are involved. You mean if a kidney is involved, biopsy is needed for the kidney, and a special immunosuppressive treatment is needed in order to prevent the loss of function, the definitive loss of function.
Of course. I heard that kidney diseases or autoimmune diseases or many different diseases in the body need to be treated by steroids, which is very important and dangerous at the same time.
Yes, you know, as kidney is a life-threatening, kidney disease is a life-threatening disease, and kidney is a vital organ. So the doctor has to commit every effort to spare the kidney. So a very high steroid dose, so-called bolus of steroid, is given to stop the ongoing inflammation at once and to spare what can be spared. In the meanwhile, a biopsy is done in order to characterize what base treatment is needed on a long-term basis, because generally this bolus steroid is not bearable for a long time. So after a while, steroids are very dangerous drugs in a big dose in a long term. So the steroids, you know, we have in the last 50, 60 years. So it means we know almost everything about steroids side effects. Steroids can be given in a definite dose and no more, and a definite time, and probably as possible no longer. If you treated a kidney only with steroid, it is called monotherapy, the termination of the illness would need such a big dose that the steroid by itself would destroy the body. That's why some extra drugs, it's called basic therapy, are needed to substitute the effect of steroids.
Okay, I know it's so common. Kidney can be treated by surgery. Surgery may be needed, but autoimmune disease, is there any way to avoid taking this treatment, this dangerous, seriously treatment?
Well, you know, autoimmune diseases come of two parts, organ-specific diseases and systemic diseases. Almost all the systemic active diseases can involve kidney. So kidney involvement is a main point, like the most frequent, the most known immune disease is lupus. Actually, I have one or two Sudanian patients in Hungary with lupus. So kidneys, almost a must, are involved in lupus. And you have to take care of that, and you have to discover it in time, and you have to commit all the effort to spare the kidneys. In order, you know, if you lost the kidneys, there is only dialysis coming, nothing else in between.
Okay, now I have to go to second break. فاصل إعلاني ثاني مشاهدينا ونرجع نتواصل. مرحبا مجددا مشاهدينا الكرام. Hello again, doctor. I'm going to try to continue my questions. Okay, some people say I got immunological bowel inflammation. If that makes sense, this sentence?
Yes, definitely. As all the organs, also bowel can have immunological type of inflammation, but the specialty in this that it's more common than average. There are two main autoimmune diseases of bowels. These are commonly called inflammatory bowel diseases, and this is very, very common in the world. The common mechanism is that the mucous membrane is destroyed and the bowel is painful, colica appears, digestive problems appear, and also some joints can pain, and several organs can also be affected, but mostly the symptoms are concentrated to the bowel.
Okay, now, Doctor, I'm going to try to jump to another point, trying to cover all the common questions about this. Okay, what if I have hepatitis, a viral? Can I get immunological treatment?
It mostly depends what the reason is. So viral hepatitis is just you characterized it as a group of hepatitises. There are several that there is no regard needed to the autoimmune disease, and there are several when the type of virus determines that you must not get immunosuppressive treatment, or if it's still absolutely necessary, antiviral treatment at the same time is also needed, especially B virus hepatitis, which we have also a vaccination against, can relapse even if was not active at all during immunosuppressive steroid therapy.
Okay. Losing hair or getting more weight or less, one of the symptoms of these diseases, but it's very disturbing for losing hair for the woman especially.
Yes.
So is there any way to avoid these symptoms exactly?
Well, you know, hair loss and hair loss is not the same. If you have a diffuse hair loss, it has generally some metabolic reasons like iron, like endocrine, but the type when it is patchy, it has immunological problems. Some new antigen is showing itself in the body, probably because a new antigen really is existing, like an infection not discovered, or probably because the body interprets falsely a persisting antigen as a new one. This is the autoimmune part of the illness, when your body misinterprets your own and reacts with inflammation that appears also here.
So not always losing hair indicated for autoimmune?
Not at all. It is. These are only rare situations, but these can be cured from immunological point of view.
Okay. Finally, if I have an autoimmune disease,
yes,
is that a big chance? Is there a big chance that my baby or my child should be getting these diseases in the future? I mean, is it genetically?
There is a definitive inheritance. Twin experiments and epidemiological data with twins. Yes, you have a bigger risk, but not as bad as that. It is some percent worse. Odds are a little bit wrong, but not with a big extent. And you can change the better time when this. The best time for delivery and for pregnancy when this chance is the less.
Okay, Dr. Yinoush, this is were very different questions. I just was trying to jump from one point to another to covering these diseases, because awareness is very important to the patients. I feel like this is a very important step for cure these diseases. If you want to add something or correct something.
Well, thank you for the opportunity. I just like to add that mens sana in corpore sano, it's a Latin proverb that it means in English that healthy mental state helps healthy
mental state and the healthy body.
yes,
Yes.
and healthy immunological state.
Okay, thank you, Dr. Yanosh Kádár, for giving us this opportunity to highlight many main points. Thank you very much, sir, and welcome in Sudan again.
Thank you.
إذا مشاهدينا الكرام حاولنا التنويع في الأسئلة عسى ولعل أنه نقوم بتغطية معظم الأسئلة الشائعة فيما يختص بأمراض جهاز المناعة. شكرا جزيلا للمتابعة ودمتم بصحة وعافية. إلى اللقاء.